my supplies, my clean gloves, a trash bag, 2 clean washcloths, my Foley catheter kit, and my female patient. I would first gather my supplies, and upon entering my patient's room, I would close the door to ensure patient privacy. I would then place my supplies on a clean, dry, flat surface area and perform hand hygiene. I'll then introduce myself to my patient, verify my patient, and explain the procedure. Hello, Mrs. Smith. My name is Bessie. I'll be your nurse today. May I see your wristband? Thank you. Can you tell me your name and date of birth? Okay. I'll be inserting a Foley catheter per your doctor's orders. Have you had this procedure done before? You have? Okay. First, I'll lay you in the correct position, then I'll clean and dry your perineal area with a no rinse soap and water washcloth, then dry your perineal area with a dry washcloth. Then I'll gather my supplies to continue the procedure. If you experience any pain during the procedure, please let me know. Also, it's important that you try to maintain as still as possible during the procedure and that you do not touch any of these supplies to maintain sterility. Do you have any questions? Okay, we'll get started. I'll adjust the bed to a comfortable working height and position my patient lying flat with her knees bent, pointed outward. I'll apply my clean gloves. Arrange my trash bag. Okay, Ms. Smith, I have the trash bag right here next to your hip. Please don't try to knock it off, okay? The bed is at a comfortable working height. Okay, Ms. Smith, I need you to lie down and bend your knees up, pointed outward. Okay, thank you. I'm going to lift your drape, then you're going to feel my hand and the no rinse soap and water washcloth, then the dry washcloth, okay? Lifting your drape. Okay, you're going to feel my hand now. I'll clean the perineal area front to back first, furthest from me. Change the direction of my washcloth. Then clean front to back nearest to me. Change the direction of my washcloth. Then clean front to back down the center. And dispose of my washcloth. Get my dry washcloth. And clean the perineal area. Dry the perineal area. Then dispose of my washcloth. I can now examine the perineal area, making sure that there's no concerns, no odor or drainage. I also have identified the urinary meatus. I can see the urinary meatus. Okay, Ms. Smith, now I'm just going to arrange the supplies. I'll remove my gloves. Dispose of them. Perform hand hygiene. I'll then gather my catheter kit. Because I already have my bag, I'll dispose of the catheter kit bag in the proper receptacle. I'll open my catheter bag one flap at a time. The last flap towards me. I'll then get my sterile gloving, open my sterile package, put my thumbs under the 1-inch border, making sure not to touch the inside of the sterile gloving. Using my non-dominant hand to grab the first glove and applying my sterile gloves, making sure it does not roll. Using my sterile glove to go under the second cuff, under the glove, the second glove's cuff, and apply my sterile gloving, again making sure it does not roll and touch my hand. I'll then gather my first drape, making sure the shiny side down goes under my patient's hips. Okay, Ms. Smith, I need you to lift your hips. This drape goes under your hips. There you go. Good job. Please note for this practice, this drape is already torn due to practicing. Okay, Ms. Smith, now this drape goes over your perineal area. Now I'll arrange my catheter kit set. Please note, due to practicing, my alcohol swab container and my lubricant container are open, but for this video, I will demonstrate as continue as if they were not open. Open my alcohol swabs and arrange them. Dispose of my catheter, dispose of the container appropriately. Get my lubricant package, empty it onto my kit tray. Dispose of this. Open my catheter sheet and dispose of this. I'll then lubricate the catheter tip. Get my syringe, uncap it, dispose of the cap. Attach the syringe to the balloon port. Okay, Ms. Smith, you're going to feel my hand again, and I'm going to clean you with some alcohol swabs, then insert the Foley catheter. When I'm inserting the Foley catheter, I want you to take a deep breath in and then a deep breath out, and upon exhalation, I'll insert the Foley catheter, okay? Okay, you're going to feel my hand now. This hand is now unsterile and will maintain on the labia. Okay, Ms. Smith, you're going to feel the alcohol swabs now. I'll clean the labia front to back with the alcohol swab furthest from me. Dispose of this. Get my next alcohol swab. Clean the perineal area nearest to me, front to back. Dispose of this. Get my third alcohol swab. Clean down the center, front to back, and dispose of this. I'll now grab my catheter, firmly holding it 2 to 3 inches. Okay, Ms. Smith, I want you to take a deep breath in and deep breath out. I've inserted the Foley catheter. I'll continue until I see urinary flashback. I have observed urinary flashback. I will continue to proceed 2 more inches. I can now stabilize the urinary catheter with my non-dominant hand. So I can use my dominant hand to insert the syringe. I've fully inserted the syringe. I will just connect it and dispose of the syringe. I'll gently tug on the catheter until I meet resistance. I have met resistance. Okay, Ms. Smith, I finished inserting the urinary catheter. Now I'm just going to clean up these supplies, okay? I'll gather the drape over the perineal area and use it to clean the perineal area free of any lubricant and dispose of all my supplies. Dispose of my supplies in the proper receptacle. I'll then secure the catheter to the inner thigh of my patient with a securement device at the verification point. I'll make sure that there is enough slack so there is no tugging. I'll then connect the catheter below my patient onto the bedside, not the bed rail. I can now remove my gloves. And dispose of them and perform hand hygiene. I'll make sure my patient's at a comfortable position, readjust the bed to a lower point, and adjust the rails if needed. So adjust the bed, the rails, get my patient in a comfortable position. Are you comfortable, Ms. Smith? Okay, I'll now educate my patient. Okay, Ms. Smith, it's important that you do not have the catheter bag go above your waist, so keep it below your waist at all times. If you need to reposition or get up and move, please use the call light. This is so you don't disconnect or kink the tubing or cause any damage to the catheter connection, okay? If you're uncomfortable at any time, please give us a call. I will then leave my patient's room, close the door to ensure patient privacy, and document the procedure. I'll note how my patient tolerated the procedure, the amount of liquid used to fill the balloon from the syringe, and if there were any other concerns, and if there any urinary input and output upon insertion of the Foley catheter.